It's cool. I call it hood suburbia. Like some
Hood
days it's
suburbia. Good
like
copywriting.
like some days it's like, Other days like, okay, we got trees here, driveways, and then you got a little bang bang from
Hmm.
time to time.
From time to time, just sprinkled in.
So
And how is your grandma? And how's your sister?
everybody's good. Grandma's doing well. My sister's good. She came back from DC. So everybody's there. They're doing their thing.
Oh yeah.
Yeah.
All right, we can jump into it.
Cool
So,
beans.
all right, everyone, welcome to another episode of We Them Niggas. In this episode, my guest Amaya. How do you say your last name actually?
Langaigne.
Langaigne.
Mm-hmm.
All right, all
Said it
right.
perfectly.
I'm saying it one more time. All right. So, welcome to another episode of We Them Niggas. In this episode, my guest Amaya Langaigne is a peer of mine from my time as an undergrad at Franklin and Marshall College, as well as a recent recipient of her master's in public health from Columbia. I definitely want to clap that up for you because I think that's a big accomplishment, and I definitely
Thank you.
acknowledge
Thank
you for
you.
doing all that work. And Amaya, I really appreciate you accepting my invitation to join me on We Them Niggas today, and I'm excited for my audience as well as myself to learn from you. To start things off, I'd love to hear what made you accept my invitation to be on the podcast with me, and what you make of the name of the brand. I know We Them Niggas gives a lot of people pause, and I'm curious what's there for you.
Yeah, thanks so much, Maseo, for having me today. First and foremost, one of the reasons why I accepted the offer is that Maseo actually came to an event I actually hosted on Black maternal health. And so that was definitely a green flag for me that you were interested in learning more about Black maternal health as a Black man who could potentially have Black children in the future and a Black wife potentially in the future as well. It's important for you to know that. So it was great that you were interested and genuinely interested to want to learn more. And then also, as we spoke further, you were not only interested in that, but interested in my story and how I was able to collaborate um, with the maternal health sphere and how that has become a part of my story. So for that, that was something that was not only amazing for me, but I felt a sense of gratitude. And so I guess this is my way of giving back and supporting your cause and what you're doing here with We the Niggas.
I appreciate that so much. I appreciate you giving back. I think reciprocity is so important, and it's become a relatively novel part of my life, I would say, in the past few years. But it's something I've been trying to emphasize a lot more. So I'm happy to hear that. That's why you're here, really. And I am interested, and I'm trying to expand my horizons. I'm trying to be more present to like things beyond myself and concerns that aren't my own. And I'm never going to give birth. That's what I'm pretty confident. But I do have a sister who's had two children. I have a mother who gave birth to me and my sister. And I wouldn't be here if women weren't giving birth. So
Yeah.
I'm interested to learn more and be more present to how I can be familiar with the concerns of women, and also just how I can be a support to people that I care about in general. So thank you.
Of course.
And so I'd love to, like, as you said, I'm interested in your story as well. I'd like to dive into that now. And so can you share a bit about your educational background and how you became interested in public health, particularly in the field of Black maternal public health?
For sure. Start it over. Sure. So, for starters, I'll start with as early as I can remember just being interested in science and math. And then the rhetoric with that is that you go into something health related. But back then, a lot of folks were either focused on like being a doctor. There was some conversation about nursing, but I really think the main premise was become a doctor if you're interested in math, science, and health. So then I got to college and I realized that I didn't really want to pursue clinical medicine. And so when I refer to clinical medicine, I mean those fields of anyone who's a nurse, a doctor, dentist, anyone who actually provides care to patients. That's more clinical. I did not want to do that. I knew going in that I did enjoy writing. And so at the beginning of college, I liked writing. I did like health. I realized that I wanted to understand and look at health on a broader scale. And so I actually got connected with someone who went to Franklin and Marshall College who was interested in public health, but on like a government track. And they were also an Africana Studies joint major with public health and Africana Studies. And so I thought that was interesting, and I knew that I might be interested in that. And so I was able to take a course, Intro to Public Health, and that really opened my eyes to like social determinants of health and really looking at one's health experience holistically as opposed to looking at it as just like we're trying to get a solution to one's health condition. So, for example, if a person comes in with a stroke, the one-sided approach would be, okay, how can we stop the stroke and move forward? But now we're not thinking about what might have caused that person's stroke. What are the conditions in their life that are causing that person's stroke? Do they even have great insurance that will be able to support their aftercare? So aftercare is everything from physical therapy, actual medication, etc. And so all of that is interesting to me. So now getting into the maternal health sphere of things, I started college in 2017. In about 2019, I was gratefully offered a position at the New York City Department of Health. And so while I worked there, I was more focused in HIV and AIDS. And so that kind of opened my mind up to more sexual health things and reproductive health. So stemming back to what I talked about earlier about social determinants of health and HIV, really learning how it disproportionately affected Black people, poor people, and many other people in marginalized groups, and how society, as well as medical providers and insurance providers, did not want to provide care to people who had HIV because it was a stigmatized disease at the time. Still trying to move away from that, but it definitely has less stigma now, but it is not stigma free. Mm. So with HIV, that kind of opened my doors up into more public health work, more hands-on and practical work. That was the summer before my junior year of college. Then I was able to, that year, really dive more into some academic work in public health and policy and such. And I think also that summer, I started seeing public health flyers about maternal health and learning about the disparate issues. And so a lot of rhetoric and conversations nowadays on maternal health talk about this kind of uprising in about 2019, 2018, really people seeing major issues around it. And I think some of the pivotal stories that brought it to light were the stories of celebrities. We see celebrities like Serena Williams and Beyonce talking about issues that they had regarding medical racism in hospitals when giving birth to their children. And so I think because these people had more status, it came to the light. That's my own perspective. Other people may have different perspectives.
I'm not familiar with like their stories. What was their experience?
Yeah, definitely. So I'm not too well versed in their stories, but the big rhetoric is that Beyonce and Serena Williams were not listened to by their providers, or they had complications during their pregnancies. I know Serena Williams specifically kept telling her provider, like, I'm not doing well, something is wrong, and the provider wasn't listening to her. And it took a lot of pleading and conversations and advocating for them to finally listen to her and understand that something was wrong. The reason I bring these two stories up is that a lot of the times, especially we can see with the 2020 uprising of like racial inequities and such, people saw that as the beginning, but that wasn't the beginning. That was just a strike. I call it like a fire blazing or fire under someone's butt that was really giving them an incentive to do work. We see people with status talking more about certain things, and that gives it uprooting. So in positive light, that can be positive and helpful to movements. But in a negative light, it takes a long time for certain movements and certain issues to gain traction if there's not someone with status and power giving that issue attention. Mm. So now, 2019, I was able to take some courses in policy regarding just general health equity and health policy. And I wanted one of my end-off deliverables for my health policy class to be a Black maternal health outcomes policy brief. So in that, I did research on Black maternal health outcomes in the United States. I also looked at current policies that were addressing it. So that was everything from the Momnibus Act, which are several different acts that the federal government is enacting to ensure and try to mitigate issues around disparate Black maternal health outcomes. And so during that time, I did research on that, slowly began learning about how social work and maternal health can come together, how doulas, and doulas are non-medical support people, and maternal health can come together. And then I started posing solutions in that policy brief. And so that's kind of how that ended. And so that was the end of my junior year, which also fell into the beginning of COVID. And so right before then, I had started applying to study abroad programs, and my intention was to study abroad in Switzerland doing food equity work. That didn't end up happening. And of course, everything happens for a reason. I was able to connect with an alum of Franklin and Marshall College, who is a Black OBGYN. She has her own nonprofit called Patients Are Waiting. And so with that organization, her and I connected, and we were able to meet and have a conversation. And she said she wanted me to join her organization in some capacity. At the time, we didn't know what it would look like, but I was interested. She was interested. And so we started the relationship. And from there, that was definitely a big pillar in my early public health career. So I started off there as a research intern. I had told the founder of Patients Are Waiting, her name is Dr. Sharice Hamblin. I had told her about my interest in Black maternal health. Perfect. And so she talked about her colleague of hers was interested in starting a doula program, and they needed grant funding. Didn't know anything about all of that, but she trusted in myself and another Franklin Marshall College student to write grants for their nonprofit. Again, no experience, just someone who trusted my interest and my love for public health and maternal health, and we were able to begin that. Started writing grants, and the money started coming in, and from there we were able to literally start a community doula program from the ground up. Just moving a little bit further into the future, I'll come back, but just to give you all some stats. So again, 2020, we started this from the ground up. Before I left, I had oversaw the first 70 clients. In almost 3 years, they've reached almost over 200 clients. And so you can see how impactful work can be done. It's a lot of groundwork. It is a lot of hard work. But once you have a passion for it and drive and people working together, it can get done. And so very grateful for that program. And so, yes, was a research intern for the summer before my senior year of college. I had plans to graduate from college early, so a semester early. Began starting planning that out. I knew that I was interested in pursuing a master's of public health. Was going back and forth about it, but I made a definitive decision that summer and went head first and started applying, meeting with admissions officers, etc. And I knew I wanted a program that supported both health policy as well as maternal health. And so that's how I ended up at Columbia University's Millman School of Public Health, where I just graduated from.
Congrats again.
Thank you. So yeah, in the midst of my last semester rather, of undergrad, I was working with Patients Are Waiting as their research intern / like patient navigator / grant writer.
We love it when
I
people are
was
multifaceted.
multifaceted. What a time it was, but I'm grateful,
Yeah.
So doing that, I also was applying to full-time graduate level programs. I was also finishing my independent study and other coursework for my undergraduate degree, and of course, trying to be a human being. So all of that was finally able to come to fruition. I graduated in December. And between January and to July, before I started my program in September of 2021, I worked full time with Patients Are Waiting as their director of programs. And so at that time, I managed 2 of their programs. And so that was the Diversifying Doula program, which I talked about earlier, that community doula program we started. Mm-hmm. And I also managed their mental health initiative, which was a mental health program that we were able to start where Black and Latinx people were able to receive 3 free sessions with a mental health clinician.
I love that.
Yeah.
One of my my favorite rappers, G Herbo, he has
Mm,
like his album PTSD came out during COVID as well, and a big like initiative he did that I thought was really inspiring and got me more interested in like the intersection of like social work and hip hop. Was
mm.
like him providing access to opportunities for like people to see a therapist, to start to have conversations around PTSD, and to raise awareness around PTSD for people. So I like that you guys were in the conversation of also making like free opportunities to connect with mental health professionals available to people. I think it's dope.
Yeah, I think, and I'll speak to that point as well, and I'll get back to what I was talking about. So, one thing I've realized about mental health, especially in Black communities, we really need to hone in on that.
Mm.
Um, I think for generational success, everything from financial success, educational success, mental success, I really do think it hits that. Um, really addressing any of the emotional and psychological issues that we might have gone through as children, but also generational ones that were passed down to us. And I think we don't acknowledge that either. I recently saw something about if we really want to be cohesive as a community, and when I say community, I mean the Black community, we really need to address these issues, but also create wholesome homes, like wholesome homes where people can go to and have solid conversations with their loved ones. And so those loved ones can pour into them. If we don't have that pour into one another, we'll never be able to do sustainable greatness. Black people are great, period. Don't get me wrong, but I think when we talk about longevity and greatness and sustainability, I really do think it starts with addressing issues and generational curses, and also creating cohesive nets and communities and families. Um, and so, yeah, I'm glad that we were able to do that for folks, create that opportunity for people to see mental health providers for the first time. A lot of people I spoke to in like the inquiry stage, they were talking about this is their first time ever seeking therapy for free, you know? Um, and so just really amazing. And then it's the same rhetoric on the doula program side. Like a lot of folks, some were first time moms and others were more seasoned moms, but still they talked about how impactful it would be for them to have another person on their behalf who's educated in this subject and in the matter to be there on their behalf to talk into them. Um, and I always talk about certain investments. Like, yeah, we may invest in properties and education, but we also should invest in our health and our well-being. Investing in a doula, investing in support people to really get you to optimal wellness is important. And so I'm grateful that through these two programs, we were able to do that. And yeah, so from January 2021 to July 2021, supported those two programs. And it was a great funnel into my master's program. Started that. And during my master's program, I had the opportunity to work part time with the Department of Health again. In this role now, I was doing more quality improvement work. And so what that looked like was certain programs that the Department of Health organizes and funds, specifically HIV programs. My job was to work alongside quality management specialists and do some of the groundwork, really looking over manuals and making sure that folks were getting optimal care, whether it was like when they met with their provider, they received care for like holistic care. So if that meant they needed a dentist as well, they needed a gynecologist as well, they needed a therapist as well, all of that. So very comprehensive, very thorough, very much trying to improve quality of care for folks.
Mm.
Um, yeah, so the beginning of the degree was more of a general overlook of maternal, well, not maternal health, but public health. And then eventually I was able to hone in on my maternal health and policy interests. Um,
Before I go into
and
that, I want to
yeah,
interrupt you just to like, I mean, I definitely want to acknowledge you for like community work you're doing with patients who are waiting. I think for me, mental health is definitely something that I'm very passionate about. I studied moral psych in undergrad because I felt like in the psych degree there wasn't really like a clear structure that was delineating like what is mental illness, what is depression, anxiety, and things like that. And those are definitely things that are really of interest to me. I've dealt definitely with crippling anxiety in my life, and seeing other men that I like that are my close friends deal with that stuff as well, people in my family. And so I'm really interested in like you're saying, like I feel that investing in the health of ourselves and our families and our community, the Black community, is so important because like if we're not addressing trauma, if we're not addressing conflict, and really closure creating ways, then there really isn't any like peace or safety that we can experience in those homes, and I think in our homes. And I think it's so important to create that environment. So I think it's dope you're doing the work of not just getting involved with mental health, but also in the world of maternal health. I think it's also important. And I just want to take a moment to acknowledge you because I think that's super dope. And I see your community activism engagement, and like there's a little clapping thing in here I never used before, but I'm gonna hit it for you.
Oh, thanks. That's so cute. I love it. I love it. I love it. Thank you. Thank you. Yeah, it's really fulfilling. That's what I'll say. So I won't get too much into the degree. I'll talk about my baby that I really loved. And so
Please.
that was my birth equity project, which I worked alongside two other Black women. Their names are Paige and Zaire, and we were able to get a social justice mini grant from our university, Columbia University, to really orchestrate and put together on our own a birth equity project specifically focused on Black birth equity and Black birth joy. And so we had two events. One of the events was more just giving people an understanding of the past of maternal health and what that kind of looks like, including everything from the effect of slavery on maternal health outcomes to how midwifery kind of and really revolutionized maternal health, but was kind of pushed away by physician medicine and then moved into the current state of maternal health, everything from what I talked about earlier, the Momnibus Act, so legislation, birthing while Black in prisons and legislation around that to ensure that people who are in prison and giving birth can have optimal care. And I say that very lightly because although there's legislation in place, there's no guarantee that those folks will actually receive optimal care while giving birth. We talked about the current state. So everything from like how COVID affected maternal health outcomes to the awareness of Black maternal health and that uprising, all of that. So that was the first event. And the second event was more of a panel for birth workers to really hone in on Black joy and what that looks like. Not only Black joy, but also Black birth joy. And so we were able to recruit and bring forth one Black OBGYN, one Black midwife, two Black doulas, and a policy official who works with the National Birth Equity Collaborative. We were very intentional about having all of our speakers be Black, given that this was a Black maternal health focused event. And so I really felt that those two events brought really great joy to all of us, given that we had an interest in maternal health, but also we were able to share this information with not only our university and school communities, but the greater community who were interested to come in and hear more about that. So that was my baby. I also had done a practicum requirement, which is like a summer-long internship between my first and second year of my master's program.
How's that?
That was really good. It was difficult at some parts, but I think I learned a lot that summer, which was last summer. And I did two things. So I continued my internship with the Department of Health, but I focused it on looking at how people's social barriers and social issues can affect their medication adherence to HIV medication. And I specifically looked at Black cisgender women ages 18 to 44. And so I wanted that age group to hit at folks who are of childbearing age. And so I was able to hear from the providers that work with those women and they were able to give feedback about the thoughts and feelings of those women around any of the barriers that they face. And so
Oh, where
many
do you see?
women,
Oh, yeah. Hmm.
yeah, so many women found and shared that stigma was a huge thing, support from their community, lack of childcare affected them remaining and adhering to their HIV medication. A lot of folks also talked about pregnant women share that they feared that the HIV medication would affect their unborn child. They also talked about like hearing false information from their partners and how that could affect them as well. And then also just lack of community cohesiveness around HIV medication and HIV treatment and prevention. So for me, like I said earlier, I have an interest in maternal health and an interest in Black women. And so I wanted to bring those two together. And so that was the first thing that I did. The second thing that I did that summer was I did qualitative coding for a midwifery school in South Sudan. So my official title was kind of like a consultant for the International Medical Corporation.
You were in South Sudan?
No, I was in New York, but it was remote work. But we did consult for the South Sudanese midwifery school. And so that was great as well.
There's like a civil war happening, or that was happening.
Yeah.
Yes. Okay.
Hmm.
That's why I was like, oh, you were in South Sudan? I was like, that's kind of crazy.
Yeah, no, if I'm not mistaken, like one of the newest African countries is South Sudan, if I'm not mistaken, I
You are
believe.
correct.
So yeah, like very important to hit at these countries that need the support. Um, so much turmoil politically for these countries, but also like women are giving birth. We were able to go through transcripts of people who did the interviews with the mothers and really get an understanding of what was going on for them. A lot of folks talked about feeling supported by the midwives. Others shared information about difficulties with their partners and their partners not wanting them to um, go in to receive care, or the partners wanted to have a stronger hold over the care that their wives receive.
Like more control.
Yeah, or like just forcible control by the clinical staff, lack of resources, nearest hospital being too far,
Mm.
lack of hygienic and clean resources, so everything from towels and clean water, all of that, and all of that affects the atmosphere that people are giving birth in. And so that was a great opportunity. And so, yeah, in terms of maternal health stuff, that was kind of like the big thing that I did during my time um, at the Mailman School of Public Health. So now I'm currently done. I just graduated last week. And I'm in the midst of looking for maternal health and reproductive health organizations to work at.
Hmm.
I like grant writing. I also like program management because I have past experience in that, project management as well. Um, Also, reproductive health, I'm very interested in that. Anything that's around equity or health equity or racial equity that I can bring a spin of maternal health to, that'd be great. So just looking for those types of positions and trying to also get involved with local organizations that I'm hearing about in the New York City area as well. I think now that I'm like not in school, I don't have school lined up, I can really hone in on getting in and down with my community in this field.
Mm.
So, yeah.
And so, what has it been like being back home in New York? Like I assert you've been able to engage with like the community being back home, just in general, like from family to friends. Like you've talked a lot about the Black community so far on this podcast. What does that look like for you? I know that you're a Caribbean person. You say living in ghetto suburbia land, suburbia. I don't even know if I phrased that correctly. Hood suburbia. There we go. I got the right words.
That is funny. So yeah, what I'll say is, so I came back from college in 2020. So I've been back in New York
Hmm.
since like late 2020. So it's almost 3 years. And now I feel like I'll have more opportunity and time and
Mm,
energy to give my full foot forward to more community health organizations. Before, it was really trying to get myself grounded and also begin my master's program. But now I think I want to really hone in on the community piece as well. I'm a
mhm,
Black person, so I also always encounter Black people every day, whether that is in my house, on my block, just talking to different people. Um, and so I really want to make a difference among my community. And so whether that is through, if I can give education in some way, shape, or form, if I can just speak into someone or just give them a resource. I recently know certain people who are pregnant. And so I've been really trying to share resources with them
mm,
in any way, shape that I can. But I also have been hearing about like local nonprofits who are focused on women's health and such. And so I've been trying to just reach out to them, see how I can connect with them, learn more about their organization and what they have to offer. Um, and so also down the line, my hope is that I can open up my own either nonprofit or organization that supports the healthcare needs of Black women.
mm,
Um, don't know what that 100% look like now, but it's definitely something that I really want to do because I can see how impactful it would be given my experience with nonprofits in the past, also working at governmental levels. Um, the government works really well alongside certain nonprofits as well. And so if I could get backing from city or state governments to support my nonprofit that I want to create in the future, I think they'll make really good strides to support those needs. So the hope is that maybe I could do two things at once as I'm starting. Like I'll have my full-time job, really honing in on maternal health, wherever that looks like. And then I can really, if I'm not working with a community level organization, my part-time gig would be community level stuff.
mm,
Um, Also, an aside, I also have a professional development business that I run where I provide resume edits, cover letter edits, and much more, all things professional development. And so I've been telling myself, and I also spoke with a friend this weekend, that I really want to divvy back into that and like hone in on that some more now that I have more time and my degree is done. And I've also learned more skills given that I'm in the midst of the job process. Um, and I also just finished up a professional degree. So that's another way that I can support my community as well. And I've
mm.
had experience editing resumes for people who live in the Brooklyn community as well. Um, and it's always been great to just hear feedback from them about the questions that I asked them in the process of reviewing their resumes and how it's helped them, job offers that they've received. All these things are really fulfilling and helpful to learn more about how I can potentially help other people. So just wanted to pitch that as well.
Yeah, no, plug it all. I'm here to give you a platform, and I appreciate you. Like you said, you're aspiring to be an educator, community builder. I definitely like to be a community builder, and definitely view you as an educator. From the moment I got on that call, like I was like, oh, I'm being informed, I'm
Yo,
learning things. You're here, you're sharing knowledge. I can tell that's like what you're passionate about,
yes.
and I'm excited to see you like creating like self fulfillment inside of like generating yourself as the person that you want to be. And I was involved like a little bit in college. There were some kids from my all boys boarding school I went to,
Mm-hmm.
called Church Farm. It was oriented towards young men from low income backgrounds across the world, across the
Mm-hmm.
country. And so that's really how I got into hip hop. Honestly, was at that school.
Got
But
it.
that aside, some of the kids that were there after I graduated started a community called College for All, like a nonprofit. And they
Okay.
were essentially trying to provide college guidance counseling to kids that didn't have like, that kind of support system, or
Oh, I
maybe had a
love that.
lackluster one in their high schools. And I was like, dang, I'm in college trying to figure out what I'm doing with my life. You guys are in high school trying to make high school better for other high school students. Like you guys are really stepping out here. Um,
Yeah.
but I assert that people that were using that tool might also be interested in your support because they're feeling unsupported then. And I can imagine they'd still be feeling unsupported, under resourced now. So I'll definitely
Mhm.
put you in touch with that organization. I don't know how active they've been in the past year, but I do know there were a
Okay.
lot of kids that went to school the year that I was involved, and it was really cool to see that. So I see some
Okay.
alignment there. I also want to
Thank
ask
you.
though, yeah, absolutely, absolutely. Anything for people in the community, I feel like it's important to have people feel connected, especially people that want to support and want to invest time, energy in supporting people.
Hmm.
I feel like it's so important to help people find the people that need support so that the good work can be done and the reciprocity can take suit, take form. There we go. Can take form.
Yes,
Uh,
yes. So,
and I was gonna say, like, what's it been like for you to learn about like the nonprofit landscape in New York? You talked about a bit like the government backing different nonprofits. It sounds like you want to get more involved, get to know people that are involved in different organizations. But like, what's your understanding of like the nonprofit landscape as it pertains to public health right now in New York and Brooklyn? Like, are there standout organizations you want to mention or that are like inspiring to you, motivating, noteworthy?
yeah, great question. So, for starters, what I've realized is grants are huge. Um, and government agencies do give grants, and also private sector people give grants. So, your people like your Bill and Melinda Gates, those big foundations, to smaller community level foundations do give grants as well. Um, the CDC can give grants. And then there are programs that work alongside the Department of Health that I've seen. And so the these programs are funded through, so when I worked with the New York City Department of Health with HIV work, a lot of our programs were funded by HRSA, which is a government agency that's a health organization. And the funds that funded HIV programs were Ryan White Part A. So Ryan White was actually an advocate for HIV, a young teenage kid who was diagnosed with HIV. He was a hemophiliac at the time.
What's that?
And so a hemophiliac is someone who suffers from a blood disorder.
Mm,
At the time, in the very beginning stages of HIV, there was something called 4-H's. And so and that's kind of the stigmatization levels of how they stigmatize people who had HIV. And so the 4-H's were, I believe, homosexuals, hemophiliacs. Um, or the other one was Haitians was one of them, and the fourth one I'm forgetting. And so what I just stated, you can tell that some of that is like, this is a little stigmatizing. Like, what do you mean? Let me just do a quick search so I can give the fourth one for
yeah,
you right now.
I appreciate that.
4-H's.
I was surprised you said Haitians like everybody. I was like, that's a lot of people.
Yeah. Okay, so here are the 4-H's. So, like I said, homosexuals, hemophiliacs, Haitians, and heroin users. And so, this article from the NIH says in the early 1980s, at the beginning of the epidemic, the scientific community did not have an official name for HIV or AIDS. And so, they called it like the 4-H disease, which was coined for the four groups that I just named. And they were kind of perceived as the folks that had the highest rates of this disease at the time. Um, and so that also meant how they were stigmatized. And so the groups that were highly stigmatized were homosexuals, heroin users, and Haitians. And then hemophiliacs were not as stigmatized, given that it was kind of, the blame game was, it wasn't their fault. It was more of like something that they were born with. Now the other people, the other groups, communities and society stigmatized them more because they put the blame on them and said that it was their fault. I also want to add that stigma has a lot to do with not only like racial and systemic issues and issues
Mhm.
that are framed into our society and our healthcare system, but it also affects the type of care people receive. And so, um, kind of getting back to the Ryan White part. So Ryan White was a white young man, white young boy. He had HIV, but he got it through because he was a hemophiliac. I believe he had gotten um, a blood transfusion, which was infected with HIV. And so, all of that being said, his name became a big name in the HIV space, HIV world. And so, one of the big funders behind some of the department and city level funds in New York City is the Ryan White Party Fund, which funded a lot of HIV clinics, hospitals, and community centers that provide care to people living with HIV in New York City. So that's kind of what I've learned in that space. What else? There's also an organization called Public Health Solutions, and Public Health Solutions is a nonprofit, and they kind of are like the fiscal branch of the Department of Health, and they kind of fund, like, help the contract side of the funding. It's a lot of technical stuff, so very difficult to explain, but that's kind of like the government side of funding nonprofits, because a lot of the clinics and hospitals are nonprofits. So they can provide care in that capacity. So that's that kind of nonprofit side. And then your nonprofits that other people are starting up, they can receive grant funding from, like I said earlier, community orgs, government, etc., and donations.
I mean, that makes sense. And then kind of moving more into, like, I know you've offered some reflections on like what your journey's been like for you. Kind of delving more into that, can you share any insights or lessons you've learned that you believe could inspire others interested in working in public health and advocating for maternal health equity?
Good question. So I would say, for starters, public health is human work. Public health is about providing quality care to people. A lot of the time, folks working in public health, given that we've had extensive training in this field, we can forget that we're actually serving real people who sometimes don't even know the terms that we're referring to. And so it's important to speak to people in basic terms, speak to them like they don't understand public health and they don't understand the terminologies and theories that we may use, but that they can understand what condition they have, how we're trying to help them, and how they can be an advocate for themselves and their communities. That's one thing. And I think also, I really do think you have to have a passion for this work. It's not something that I would say you should go in if you're like money hungry. I think you should go into this if you're passionate about it and you want to do well. Not to say that people shouldn't get good compensation for their work. I'm a strong believer in being well compensated for the work that people provide. But I think because this is human work and work that we're providing to people who are in sometimes vulnerable populations and vulnerable situations, we need to acknowledge that we need to provide the human touch when we're providing programmatic changes, we're making policy shifts, we're giving advice and consultancy on how an organization, a healthcare organization, should manage their financial funds, right? And so your hospital, when you go to, if you need to go to the emergency room, the people at the head are those people that are managing the money that when you go there, can you get a hospital bed? That's if they allocated funds to make sure that each patient can get a hospital bed. The doctors and nurses on staff. There was recently a strike in New York City with certain hospitals
I didn't know
because
that.
nurses were not receiving. So they had like a high patient load. The patient load to staff ratio was ridiculous.
Mm.
Nurses would have extremely high patient loads, and the financial incentive also for them as they're working did not equate to that. So it's not only about, like I said earlier, it's important that people are paid equitably for the services that they provide, but also we cannot be giving so many patients to one nurse. That's inequitable for them to serve those amount of people. And that's not human work. We're not doing the nurses justice. Neither are we giving patients justice if we're providing that inequitable ratio patient to nurse situation. And so that all goes back to if people are allocating the correct amount of funds to make sure that there are resources that each patient can receive equitable care, right? And so all that being said, this is a lot about care and human work, but it's also about really stepping back and saying, how can I help this person? And not, well, let me just give all of my public health terms and my health terms and all of that stuff to this person and they'll be good. No, because some people don't even understand that. They're really here to make sure that they can do better and be well in the future. And so we really have to step back, say to ourselves, how can I say this in the easiest terms for this person to understand and move forward with that.
That makes sense. I appreciate you sharing that, and I think I'm like what I'm really hearing is that if you're not taking care of the people who are providing the care effectively, then it's really hard to sustainably provide the care that you want to be providing to people. And I'm hearing that's like really the like what's at the heart of like human-centered approach is like centering people at every opportunity, because like without people, work doesn't get done.
The
Without
work
people,
doesn't
the
get
people
done.
aren't taken care of. And like it's not just the people that are showing up as clients or in this case patients that need that care, but the people that need to do the work themselves need to be taken care of and need to be able to take care of themselves.
Without a
See how
doubt.
that ratio doesn't work.
Yeah.
So I appreciate you going into that. And then I'm also curious, amidst your journey in the field of public health and advocating for Black maternal health, have there been any surprising or unexpected moments that have challenged your preconceived notions in or outside the classroom or made you reassess your approach?
And so I think what I just told you all about, because I've been in academia and I've also been through the graduate level training, a lot of this stuff can be jargon terms, theories that people who are actually receiving the care will not understand. And I'll give you an example. I remember during my time with Patients Are Waiting, during our intake process, we wanted to be culturally sensitive to different identities, etc. And so one of the categories we had for people to identify themselves was Latinx. Some people had heard the term. Some people who identified or would be quote unquote categorized in that category understood the term, and others were like, I don't know what this is. I'm a Latina, I'm a Latino, or I'm a Hispanic person, you know? And so because we're in academia sometimes, we're in that rhetoric, we're in these theoretical conversations, our mindset is to just go forth with what society is telling us to say that's culturally correct. But sometimes we also need to take a step back and see what are the actual people who identify in these groups that we're trying to serve, what are they calling themselves? What are they saying about certain things? And using those terms. And I think finding a good balance between the two can be helpful because, of course, at the end of the day, this is about these people. So that was one example. And I think also on the other side, like health literacy. So when I say health literacy, I mean the idea that someone can understand the health terms and conversations and diagnoses that a provider is providing to them, or whomever is in the healthcare space is talking to them and educating them about. And so a lot of the time considered or talked about at all when someone may go into a doctor's appointment. And that's important because that's someone's health. So if a doctor doesn't give a person or the person the opportunity to ask questions or give that information to them in layman's term and the most simplest terms, that person will leave the appointment more confused than they did coming in. I had a course the last semester of my MPH degree, and one of the conversations we had was about when a clinician is diagnosing someone with an STI, for example, or like reporting their stats back to them. Given that person the information in layman's term is important. You can say all of these jargony terms, but if you say the word cancer, right? Even if you might have said you are at risk of cancer, the person heard cancer. And so now they could be going home and saying, oh my gosh, I have cancer. You lost the whole message when you gave all of the jargony terms, all of the scientific terms, and the person left with cancer. So that's important, like that we acknowledge how we speak to patients, how we relay information to patients, and how we explain information to patients. And also giving patients the opportunity to ask questions about their health is so important. I can speak from personal experience, like just hearing doctors getting upset with patients when they ask many questions. The aura in the room becomes more aggressive and impatient when patients ask questions about their health, because yes, doctors have high workloads, but also like it's your job to really explain this to this patient so they understand how to move forward.
Yeah.
And so health literacy is quite important. Um, and so, yeah, I think those are two big things, the health literacy piece and what I talked about earlier, just about providing that human care.
Yeah, no, I got that. And in the world of health literacy, do you see like you're saying like people like doctors have a high workload, and it's a challenge to like ensure that people are getting clear on like what their situation is from doctors or from the people that are taking care of them. Do you see like any tools or people trying to solve like that problem, like the issue around health literacy, and maybe a lack thereof?
Hmm. That's a good question. I would say, I think how I answer this is what I would potentially like to see.
Okay, I like that.
Like more doctors asking their patients questions um, about kind of like their past and like understanding the person overall. And I get it, like some visits and some appointments aren't long. Um, but even if you don't have the opportunity to ask about the person's entire life, there are certain questions that I think can get done in those intro sessions as soon as you enter the room that can funnel into the conversation that's had at the end about, okay, tell me here's an example of question that could be used. Tell me what you understood about what I said.
Mm.
Can you share with me your thoughts and feelings about the conversation that we just had and what I just told you? Do you have any questions for me about XYZ? And being specific about what XYZ is. So if someone just received news that they have a diagnosis, the doctor asking, do you have any questions about how to manage your XYZ disease? Do you have any questions about this disease? Do you have any questions about um, how you can move forward with this disease, as opposed to, do you have any questions for me?
Mm.
And then there's silence because someone may have a lot of questions.
Yeah.
I think also encouraging people to go in their office with their appointments, rather, with pen and paper to take notes of what the doctor's saying, or their phone to take notes about what the doctor's saying. And also an added piece is write down a list of questions that you have for your doctor before you go into an office, so that you have those questions written out and so you don't forget them, and you can ask your provider those questions throughout the appointment. Because at the end of the day, it's your appointment. It's about you. The doctor's just there to support you and be that professional who's trained, but the appointment is about you.
Yeah, and it's important to be an advocate for yourself as well.
Exactly.
But I hear what you're saying really about having like these professionals be like actively engaged in listening to patients from the outset, so clear on like their perspective and their understanding, and what they
Without a
might have
doubt.
trouble understanding as the conversation progresses, and like what is there to be understood becomes more clear, or maybe not, but like that's why the questions are important. That's also what I'm hearing.
Mm-hmm.
I know like this is kind of, I feel like we can wind down the discussion around this stuff, but I'm interested in like you talked a lot about the Black community, and I have the Black community is not a monolith. And so I want to give you a bit of space to talk about like your background as a Black person. I know you shared with me that you're Caribbean, Jamaican, question mark.
No,
See, I was like,
I'll
I
get
feel like
into
I'm about
that.
to be wrong. And I was like, but I'm going to take a guess because I feel like, why not? I can be wrong.
Yeah, definitely. And I think that's important to recognize that the Black community is not a monolith. There's not one skin color, accent, dialect, tonnage. None of that is just, it doesn't look like one thing for the Black community. So myself, again, my name is Amaya Langaigne. I am Caribbean American. My family's from Grenada. I rep Grenada all day, every day, like I was born there. born and raised in Brooklyn, New York, though. And so the neighborhood in which I was born and raised in is Canarsie, Brooklyn, which is highly um, populated with Caribbean immigrants. Um, and so I grew up around a lot of Black people, but they had like the Caribbean American experience. So that may look different from someone who has never really been around Caribbean people, but they've been around other Black people um, who may have like a African immigrant experience or an African American experience, whose family has been in America for several generations. And so, yeah, I think for me, being Black in this country is really about just embracing what it is to support Blackness. Everything from um, Black hair. I know I'm bald now, but I used to have hair. Black hair, Black skin, Black health, Black well-being, Black mental health, um, Black joy. Black joy is so important. I think also I'm big on education as well. Like education also doesn't have to look um, like going to get a degree, but education can look like just learning. And I think for Black people, learning can be our way out of certain situations because when you learn more, you learn that there's better out there and that you deserve and you can achieve better. And so whether that is taking a course on how to code some stuff or taking a business class, taking a financial literacy class, educating yourself on your mental health. These are ways that you can open the doors to learning more and understanding that there's more to your own bubble and popping that bubble and learning more. And I think I'm ever so more biased and passionate towards Black people because I think we're such an intelligent set of people. We just need that support and reinforcement from each other so that we can move on and really make great change.
Absolutely. I'm a huge proponent of education. I think like education doesn't have to be in a classroom. Education can be going on YouTube and asking a question. It can be opening up ChatGPT now and asking a question and follow-up questions. ChatGPT, I think, is like Google on steroids and like everything I wish Google was so all of my life until this point.
All of my life, like, wow. Yeah.
and I started using that as you're doing like your resume, cover letter stuff. Now I feel like that's a really good tool. I did use some ChatGPT for some of my questions as I was trying to like figure out like how do I ask like better questions. So I like you saying those are good questions because ChatGPT did do some assistance. And
Mm-hmm.
I think it's like just important to be like thinking about like what do we want to learn more about? Like what are we excited to learn more about? I was at my boarding school's alumni weekend last weekend, and I was a panelist talking about like my experience going through school, and I talked about how I felt like at boarding school there was like so little to do, and I played like a lot of video games, I watched a lot of anime, and I listened to like more discographies than I can like name and count. But I feel like what I wish I had done more of was divided my time between like things that had like no bearing of like information on like the actual world and things that did.
Mm,
Because like I can know everything in the world about One Piece's anime and like everything about Young Boy's discography up to 2019. But like if I don't know anything about the political landscape that's impacting me, or like what I want to do with my life, or like what technology is important to be using in the classroom or outside the classroom, or even like you're saying mental health, like I feel like I could just be on YouTube asking any question. And I feel
yeah.
like as a kid, when you have so much time that's like disposable, I think it's really important to recognize how many opportunities and how many resources there are to learn from and using that aren't like boring, like picking up a textbook that like some professor might assign you that maybe doesn't feel like relevant and engaging. There are people out in the world doing creating content that I think is exciting. I think of like oh my gosh, I think of like history with like John Green is Crash Course. Crash Course. I think
Mm,
that's like the for me the prototype of like engaging informative content on YouTube.
yeah.
I think
Yeah.
there's so much stuff like that. Ideally, one day we them niggas, and maybe today this episode is like Crash Course. You heard it here, and
Yes.
like this is
Yes.
a place to come and learn and to find resources. You want to learn about computer science? We can help you do that. You want to learn about the public health? We can do that. You want to learn about anything really? Put in ChatGPT and say how do I learn about it. That's what I have to say.
Mm-hmm.
Um,
Mm-hmm.
but I think it's so important. I think education really is the solution. I think we are intelligent people, and I think really making sure that in this world of noise and where people are fighting to monetize our attention, that we
Yeah.
really recognize our attention as an investment that we're putting places. And I think when we put it in places that serve us, we are investing in ourselves, in our communities. Um, And yeah, I appreciate you saying all of that. Um, what when you say like your Caribbean like heritage, like being in states, actually my boarding school was the first place I encountered, I feel like, people who had a Caribbean American experience, and I was like so thrown off. I was like, these are not African American people. Like, what is going on here?
Yeah.
And I feel like really it was getting into F&M and being surrounded by dramatically more, I feel like, Caribbean American, and African American people who are the children of African immigrants or international students themselves, that really had me get more familiar with like the life world of people who are not African American, and their experiences. What was that like for you, being at F&M, being in at Columbia as a Caribbean American woman?
Yeah, that's a good question. So before leaving New York, my idea of like the Black identity, because I was born in this country,
Mm-hmm.
I kind of fit in this interesting bubble. Like, I'm not an immigrant,
Mm-hmm.
but I'm also an American, but I'm also not a child of someone who's been in this country for such a long time. So for me, the best way I can describe it is, for me, my identity and my understanding of what a Black person was at the time before heading to college was that they were like Black people who had an understanding that they were not only Black people from this country, like, and it was more focused on the Caribbean side of things. So in my head, I was like, okay, everybody eats like rice and peas and chicken and like these things. And I thought that was like a staple meal for everyone.
Mm-hmm.
Then I got to college and I was like, okay, this is different. Like, some people hate rice. Some people, like, their staple meals at Thanksgiving look like baked mac and cheese, yams, etc. In the Caribbean, yams are not what yams that Black Americans, they're not the same.
Mm-hmm.
So that was also
I don't know. So what is the
a culture
difference?
shock.
What is?
So
Because I'm confused.
um, so the yams that I learned about are like sweet potatoes that are like cooked down, and it has more of like a sweet
Mm-hmm.
taste, right?
Mm-hmm.
Yams in the Caribbean are like a earthy. They're similar to potatoes, but like tougher and more starchy.
Mm.
Um, yeah, they're like white yams. They don't look any, and it's not a cooked thing. Like, you can cook yams, but yams are not cooked, if that makes sense, in the
Mm-hmm.
Caribbean. Um, what else? Like, there's also a different rhetoric and conversation around Black Americans in the North and Black Americans in the South. Very different cultures and rhetorics and conversations. Um, I personally haven't been to too many southern states, um, but like, I feel like there's a really rich Black American Southern culture that
Mm.
a lot of people don't talk about in the North, from what I've understood. Um, Different terminologies. Black Americans go hard for like certain foods and stuff, which I feel like Caribbeans and Africans do as well. And Caribbean Americans and children of African immigrants do as well. And I think another thing is, there's a big thing about like Black diaspora wars amongst these communities, which is harmful. Like, I think it's interesting and important for us to have those conversations amongst ourselves as Black people. But once we leave that conversation and allow other people who are not in these spheres to understand and hear about these conversations, we're doing ourselves a, an injustice,
Mm.
because it's showing other people, oh, these people are divided, so we can come in and infiltrate this divide and make it further. That, I think, is harmful. And so again, I want to hone in on, I think it's important that we can understand and talk about our differences and explore our differences. I love um, like trying more and new Southern foods and home cooked Southern foods and home cooked Black American foods and stuff. And my friends as well, they love tasting different Caribbean foods, Grenadian foods, etc. Um, and even within those bubbles that I talked about, there's nuances in those bubbles too. Like, it's a lot.
Mm-hmm.
But once we get to that point where we're leaving the space of Black people and we're allowing non-Black people to see that we're divided, that's a problem.
Mm.
Because, like I said earlier, they will see that and be like, okay, well, I can continue to try to divide these people because they're already divided.
Mm.
And that's harmful to us. So.
Absolutely. And see, like those were like the main things that you got kind of out of navigating your Caribbean American experience, traveling through these spaces.
Yeah, I think one last thing, like given that like that was my a big part of my identity growing up, there were some parts where I didn't feel like it was supported when I was in college. And so I was like, you know what, I'm gonna try to like get this done myself
Mm-hmm.
and try to find my community here, that is Caribbean. And then in the midst of that, I learned about African culture. Like my college experience was some of the first time where I tasted home cooked different African dishes. I tasted injera from Ethiopia. I tasted different like stewed meats from Ethiopia. I had jollof rice from Nigeria for the first time. Um, Different West and East African foods I tasted for the first time that I think I probably would have tasted in my life if I didn't attend Franklin Marshall College, but it wouldn't have been as quickly as I did. And those are really good foods. So, yeah.
I like that. I appreciate you walking through that and sharing all of that with us. I'm going to let us like, wrap up now.
Okay.
So I want to thank you so much for your time today. I feel like you've really been a contribution in sharing about like not only now your experience as a Caribbean American woman who's going through these different educational institutions, which are predominantly white and historically exclusive. And I appreciate you sharing about that, but I also appreciate you sharing about what you've been learning in the world of public health, what that journey's been like for you, impact, and also just like helping us understand like what what challenges are currently in the world of public health that are facing mothers specifically, as they are around the world. Like you talked about South Sudan, like I really had never even considered like what are the conditions being navigated by women giving birth without access to a clean space to do that. Something that is
Mm-hmm.
so intimate, so involved, and people don't have safe spaces. I can imagine that would be anxiety inducing, but also like there's concern about infection and things like that. And so I appreciate you going into that, but also diving into the world of mental health and the impact that you've had in Lancaster and New York, and abroad, like I said. So I definitely want to acknowledge you for doing all that stuff and being contribution, not only like here and sharing and educating us, but also like through the work that you're doing. Can you share with my audience like what's the best way to connect with you? How can people follow up with you if they want to reach out to you?
Yes, of course. So I'll also plug my business again. So my business is called Support by Amaya, professional development business. And so you can follow on Instagram at support, SUPPORTBY by Amaya, AMAYA. So that's Support by Amaya on Instagram. That's the same thing on Facebook.
I'll
You
link
can
that in the show
also,
notes.
yes, thank you.
Mhm.
You can also feel free to connect with me on LinkedIn. So my first name is Amaya, Amaya. Last name is Langaigne, Langaigne. What else? Yeah, I'll just leave those two for now.
Perfect.
So yeah, my personal development business and then connecting with me on LinkedIn. Feel free to message me. I'm pretty responsive there on LinkedIn, and then we can connect further with emails and such. But yeah. Also, Maseo, thank you so much for having me today. I do appreciate it. Yes, just extremely grateful that you thought of having me, and I'm grateful to have been a part of your podcast today. So thank you.
Yeah, I mean, you're so welcome. I mean, I feel like I can't thank you enough. I mean, I'm always on the lookout for people that I feel like are modeling what I think it looks like to be a contribution to the community, to be an activist, to be engaged, to be community oriented, and showing up to hear your call. Like I saw you post on LinkedIn, I'm doing these public health, maternal public health things, and I was like, I don't know much about that, and I kind of missed like all like the different talks they had at F&M. Like this week we have this person coming in, we have a common hour, but then you have like different departments hosting different speakers on different random days at like 7 p.m.
Mm-hmm.
And so I'm always looking for opportunities to jump into calls like that, whether that's Twitter Spaces or a Discord call or Instagram Live or like a Zoom call that like someone links on Twitter. So I was excited to see someone that I know doing something that seemed more personal and more niche and relevant to me and my community, especially being this is the We Them Niggas podcast and brand I'm trying to build here. I want to identify people that are building and modeling what I think it's like to be someone contributing to the community, uplifting community, and building for the long-term health of this community. I
Yes.
definitely see you as someone that's doing that, and I was excited to be able to invite you and that you accepted my invitation despite the name that I have, because I have some people that are like, I can't associate with that Maseo, and not there's nothing wrong with that, you know. Like people want to operate and feel comfortable with the way they're operating and everything they associate
Mm-hmm.
themselves with. But I feel like in so many instances, people are forced to assimilate or leave behind parts of their culture. And I feel like I know so many Black people would say nigga every day and like every sentence. And then the moment they get into a white space, that vanishes. And I know that's in me. And I feel like I don't want to live my life that way. I don't want to find myself in spaces that leave me feeling that way. And I want to create spaces where people can show up as their authentic selves, whatever that looks like, regardless of whether or not they want to say the N word or if they're Black at all. Like I just want to create a space where people can do that and talk about what it looks like to invest in community and kind of share knowledge and create intercultural opportunities for intercultural mingling. So I really appreciate you being here, accept my invitation, and being the contribution that you are on and off the podcast.
Of course. Thank you.
Yeah, absolutely. And so thank you everyone for tuning in to We Them Niggas again today. You can follow us on Instagram, me specifically at Maseo_D_Langston, and on Twitter at WeThemNiggas.lens.lens for updates and releases. You can join our Discord community as well if you'd like and connect with us during our weekly community calls at 7 p.m. Eastern Time. If you reach out to me on either of those two platforms, then I can set you up with that link. We can have a call to get connected. Let's inspire and make a positive impact together. That's what we're here to do. So feel free to reach out to me, like I said, via email at maseowatley@gmail.com or socials if you need any assistance or I can do anything to support you. I'm excited to support people who are value aligned. So stay motivated, stay inspired, and keep changing the world. This is We Them Niggas, signing off until next time. Booyah!
Very nice. Loved it. Loved it.